lines up with the previous speakers have said here, that we did try to meet the Minister about 500 cases that we have, approximately, give or take a few, because we deal directly with patients about their experiences of what's actually happened to them. We're not just sort of, how to say, floating ideas or whatever. And regretfully, the word we got back was he was too busy to meet us. So in the meantime, we have continued on with the work that we're doing, albeit a little bit more restricted. But we hope that this year we break through the clouds and see a bit of blue light. Thank you.
I suppose a related question then is to Ray, the whole question of the gap clause that's been proposed for the new contract, that you won't be able to criticise the Minister or the Department.
Well, the new contract is a 39-page document. You need your lawyer on your arm to read it. There is a gagging clause in there whereby if you want to make a point, you need permission. If you make a point and you've misinterpreted that you shouldn't have made it, and that they feel that you shouldn't have made it, you can have your contract cancelled. You are to request a new contract on your 4th year if you want another one, and they will take a year to assess it. They're the type of things in that part. Effectively, what comes across is the HSE want to take over general practice. There's a lot of questions in there in regard to data collection. There's no specifics on this data collection. If anybody's reading the papers in the UK today, you will see that data collection in the NHS has come up. And that was opposed by the sister organisation, the IMO, the BMA, the Royal College of General Practitioners, and lots of other patient advocacy groups. And it turns out that possibly that data was going to be sold by the state in the UK, and that's on hold. We have major concerns in regard to what data sets they're looking for. We're being asked to do surveillance. There is no specification on what the surveillance is. So effectively, we're being asked to police patients on many of these occasions, as opposed to if we're policing patients and we're collecting bureaucratically irrelevant, non-medically evidenced data. Unfortunately, we can't do what we're good at, which is acute care, chronic care. They're effectively fundamentally changing the way general practice works, and we have major concerns with that. And that's in the context that over the last 4 years, you've 160 million withdrawn from general practice.
Could I just come in on the voice of service users? I mean, I think one of the difficulties is that 45% of the population have private health insurance, but a lot of the time they may feel that they're affluent because they have that, and yet almost half this room has private health insurance, and I'm not sure they have a voice. I think that Stephen